7. Independent living, health and social care. To achieve the long-term overarching ambition and the high-level outcomes for independent living described in Section 4, this section sets out the outcomes we expect to see over a 10-year period, as a result of the actions we must all take to ensure disabled people have the same freedom, dignity, choice and control as other citizens at home, work, in education and in the community. Independent living, health and social care is made up of the following themes: well-being and health, care and support. Well-being. Outcome 1. Access to well-being experiences. Disabled people have equitable opportunity and rights to participate in the delivery and enjoyment of enriching experiences across arts, sport, heritage and culture. They are supported to do so by workforces and organisations that value the contribution of disabled people and understand their role in protecting disabled people's right to participate in cultural and sporting life. Outcome 2. Inclusive recreation and play. From childhood, disabled people can engage in local accessible play, recreation and leisure activities alongside their peers, including through disability-specific events, with the equipment and instruction necessary to overcome barriers to participation. Outcome 3. Equal expression and communication. Disabled people can engage with local services and express themselves freely in their preferred languages, both verbal and non-verbal. They are enabled through the provision of resource and training to access technologies that support all forms of communication, including British Sign Language and Welsh. The outcomes above align to Article 30 of the UNCRDP, which sets out that disabled people have the right to participate in cultural life, recreation, leisure and sport on an equal basis with others. Additionally, under the United Nations Convention on the Rights of the Child, UNCRC, which applies to all children, Article 15 sets out the right for children to meet and join groups, and Article 31 the right to play. The well-being and inclusion of disabled people in culture, heritage, arts, sports, play and leisure are key to a lively and inclusive society. By removing barriers and promoting accessibility, we make the lives of disabled people better and create communities where everyone can take part and contribute to. However, disabled people continue to face barriers to accessing cultural, heritage, arts, sport, play and leisure activities. Physical barriers, promoter/venue policy, proportional ticketing, lack of information and inadequate training of staff are common problems. Access to banks or building societies is also highlighted as a barrier for many disabled people. Accessible leisure and retail facilities can help the local economy by attracting more customers. Additionally, accessible play, leisure and retail facilities improves inclusion, equality and community engagement. However, the 2016-17 National Survey for Wales found the most commonly reported type of building that disabled people had difficulty accessing and using was shops, 45% of disabled people, followed by hospitals, 38%. Of those who had difficulty accessing public buildings, 41% said their difficulty related to moving around the building. 25% reported parking problems as a difficulty, and 22% reported inadequate lifts and inadequate toilet facilities. By making exhibitions and performances accessible through provisions such as British Sign Language, audio descriptions, and neurodivergent friendly environments, society helps ensure that disabled people can engage with and contribute to the preservation and celebration of our diverse cultural heritage. The arts serve as a great way for people to express themselves and take part in the local community. Inclusive arts programs and accessible venues provide an opportunity for disabled artists to showcase their skills and talents and share their views, challenge stereotypes and promote inclusion. Welsh Government continues to support Hijinks, a professional theatre company working to pioneer, produce and promote opportunities for actors with learning disabilities, stroke, autism to create theatre and film productions. The Priorities for Culture, published in May 2025, set out the Welsh Government's priorities and ambitions for museums, libraries, archives, arts and the historic environment. This includes Ambition 1, making culture inclusive, accessible and diverse, which is a priority for the first year of implementation. For disabled people, this includes making cultural venues more accessible for disabled people who visit, work and volunteer, making venues more representative of disabled people, and enabling disabled people and a carer or companion to attend and participate. Over £3 million capital grants have recently been awarded to cultural organisations across Wales to undertake capital improvement projects, including accessibility improvements to cultural venues for disabled people. The Transformation Capital Grant Programme supports museums, archives and libraries to make improvements to buildings, including accessibility improvements. The HINT scheme works across the Welsh arts sector with theatres and arts venues to provide a consistent offer for visitors with an impairment or specific access requirement and their carers or personal assistants. Arts Council Wales also runs the Creative Steps funding programme, which supports individuals and organisations, including deaf, disabled and neurodivergent groups or individuals, to overcome barriers to accessing Arts Council Wales funding. Cadw offers a disabled person's membership, which allows a disabled person plus a companion to enter all Cadw staffed sites for free. There are also access guides for each Cadw property to help disabled people plan their visit. Cadw has been improving access to its properties for disabled people. This includes the installation of a bridge at Castell Harlech, bridges and a lift providing access to all floors of the Kingsgate at Castell Caernarfon, and this year new ramps and paths at Caerphilly Castle. There are also hearing loops installed in all Cadw visiting centres. Participation in sports and leisure activities is important for physical health, mental well-being and relationships. Accessible sports facilities and inclusive programmes support disabled people to experience the rewards of an active lifestyle. Sports also provide opportunities for teamwork and creating a sense of belonging and mutual support. Welsh Government will continue to work with Disability Sport Wales, who aim to create an inclusive sports sector. As part of local authorities' play sufficiency duties, there is a requirement to assess the sufficiency of play opportunities that are inclusive and accessible, that encourage all children to play and meet together if they wish to. The duties recognise that children and adults with impairments are disabled by barriers that commonly exist in society. These barriers include negative attitudes as well as physical and organisational barriers, which can prevent children from taking part in the range of play opportunities in their area. The Welsh Government supports children's play opportunities in improving the quality of play spaces and playgrounds. Local authorities have the flexibility to purchase large-scale items to improve the quality of play spaces, refurbish the playgrounds and support in creating inclusive and accessible play spaces. We are taking proactive steps to increase the availability and quality of accessible exhibitions, performances, matches and events, ensuring they are accessible and inclusive. This includes efforts to remove physical barriers and discriminatory ticketing policies, show clearly provision of British Sign Language, audio description or autism-friendly performances. Health, care and support. Outcome 1. Coordinated and timely care. Disabled people of all ages are empowered to exercise their right to the highest attainable standard of health through coordinated, seamless and timely access to the right care and support, which addresses current inequalities and overcomes existing barriers, including those faced during transfer between providers or age-related services. Outcome 2. Accessible care settings. Disabled people receive care and support within social care settings, both in-person or remote, that are accessible, equipped with the facilities and functionality to ensure all access needs are met across all ages. Disabled people have autonomy to choose how and where they receive their care and support. Outcome 3. Right-centred and person-centred care policy. Disabled people participate in shaping policies related to their care and support through inclusive and collaborative approaches. Policies and guidance provided to local authorities, health boards, primary care contractors and Welsh NHS bodies aim to reflect the Welsh Government's commitment to embedding the social model of disability and removing barriers that limit the independent living options of disabled people. This commitment promotes the rights of disabled people in health, social care and independent living. Outcome 4. Supportive care providers. Disabled people have equal access to health and social care services. Health and social care and support services providers are properly equipped to meet the varied and intersectional needs of disabled children and adults, with workforces that understand disabled people's rights, the social model of disability, and their own obligations under the Social Services and Wellbeing Act, working collaboratively across organisations to improve quality in care. Outcome 5. Reduced inequalities in care. Disabled people are represented within the governance of health and social care, with a renewed focus on removing discrimination and promoting proactive, accessible practices to improve service standards for all disabled people, including those with intersectional needs. Outcome 6. Transparent communication in care. Disabled people understand their rights to access health and social care and are empowered through the broadened All Wales Accessible Communication and Information Standards 2025 and the Welsh Language Active Offer in Mwy na Geiriau, More Than Just Words, to communicate freely with their care providers and support networks using the formats and languages that best meet their individual need. Outcome 7. Unpaid carers. Unpaid carers of disabled people are recognised and valued as key partners in the health, social care and educational plans for the person to whom care is provided. Outcome 8. Unpaid carers. Unpaid carers have timely access to information and are aware of their rights to support. Outcome 9. Climate change in healthcare. Disabled people are actively involved in shaping policies and practices that address the health impacts of climate change. Their lived experiences inform the development of accessible adaptation and mitigation strategies, ensuring that responses to climate-related health risks are inclusive, equitable, and reduce existing health inequalities. Outcome 10. Emergency planning. Disabled people are actively involved in shaping policies and practices that pertain to planning, response and recovery to public health emergencies. Their lived experiences guide the development of accessible response and recovery strategies, ensuring that emergency measures are inclusive, equitable, and help to reduce existing health inequalities faced by disabled people. The outcomes above align to Articles 25 and 19 of the UN-CRDP. Article 25 of the UN-CRDP sets out disabled people's equal right to the enjoyment of the highest attainable standard of health without discrimination on the basis of being a disabled person. Article 19 of the UN-CRDP, a pivotal right in the treaty, sets out disabled people's right to independent living and community participation. It requires measures by countries to enable full enjoyment of this right, allowing individuals to choose where and with whom they live, without being forced into specific living arrangements. Article 11 of the UNCRDP provides for situations of risk and humanitarian emergencies. It requires measures by countries to take all necessary measures to ensure the protection and safety of disabled people in situations of risk, including humanitarian emergencies and the occurrence of natural disasters. In the 2021 census, the proportion of people in Wales who reported to be disabled was 21%. National Survey Statistics and Research 2019 showed that 38% of disabled people reported having difficulty accessing hospitals. Of those who reported difficulties accessing any public buildings, 44% identified issues with moving around the building, stairs, doors, narrow corridors, parking problems, 38%, inadequate lifts or escalators, 26%. Accessing healthcare can be particularly challenging for disabled people, and evidence demonstrates poorer health outcomes for disabled people. The overview report on mortality amongst people with a learning disability showed that there was roughly a disparity of 2 decades in the typical age of death with the wider population. For those with mobility impairments, inadequate parking facilities, inaccessible clinics, and hospitals can make it difficult to attend appointments. The failure to provide interpretation services for disabled people, including British Sign Language or through the Deafblind Manual, for example, can prevent or complicate access to healthcare services for deaf people and people with sensory impairments, such as deafblind people and blind or partially sighted people. These barriers can lead to missed appointments, delayed treatments, and poorer health outcomes. Providing inclusive healthcare requires the provision of accessible facilities, including parking, and effective communication support to ensure that all disabled people receive the care they need. In 2018, the Welsh Government published its National Strategic 10-Year Plan for Health and Social Care, A Healthier Wales. A Healthier Wales sets out a vision for everyone in Wales to have longer, healthier and happier lives, and to be able to remain active, independent and in their own homes for as long as possible, supported by an integrated health and care system. To ensure the actions taken under A Healthier Wales over the next few years remain the right ones, the Welsh Government published 35 refreshed actions in December 2024. These actions have been designed around what an effective health and care system should look like. We have chosen core principles which reflect our ambitions, one of which focuses on person-centred care, where we want our approach to be person-centred so that people can receive the right care they need at the right time and in the right place. And one which aims to reduce health inequalities by ensuring equality of access to the health and social care system to achieve equity of outcomes. Under the core principle of providing person-centred care, one of our specific actions is to ensure that all citizens can receive timely health and care services equitably, regardless of the language or communication format they need. The Welsh Government is determined to ensure access and inclusion is considered fully from the start of every disabled person's healthcare journey. This includes a range of services from the accessibility of 111 and the NHS Wales app, to suitable parking facilities, to the inclusivity of GP surgery's primary care contracted services, including GPs and hospitals. The Learning Disabilities Strategic Action Plan is delivering the commitments made in the Improving Lives programme, seeking to improve outcomes through better understanding of higher mortality disparities, including highlighting avoidable deaths, increasing access to annual health checks, and delivering the Paul Ridd Learning Disability Training for health staff. The All Wales Accessible Communication and Information Standards, the Standards, aim to ensure that people who are deaf, deafened or hard of hearing, people who are blind or partially sighted, people who are deafblind, people who have language and communication access barriers arising from an impairment, including dementia, learning disabilities, and mental health conditions. People who have language and communication barriers arising from neurodivergence receive appropriate communication support when accessing healthcare services. These standards expect healthcare providers to proactively offer information in accessible formats to ensure equity of access for all. In 2023, the Welsh Government committed to broaden and renew the standards to ensure they represent people with other types of impairment. The effectiveness of these broadened standards, when implemented, will be regularly reviewed to promote inclusive healthcare. The Welsh Government is committed to ensuring the health and social care workforce, including prison health staff, is knowledgeable in understanding the social model of disability and embedding it into their practice through comprehensive training for all healthcare staff on the diverse needs of disabled people. Timely and coordinated hospital discharge processes support the well-being and recovery of disabled people. Prolonged hospital stays can delay recovery, increase the risk of picking up hospital-acquired infections, and lead to mental health issues such as anxiety. There is sometimes an imbalance in our health and social care system and missed opportunities for prevention and early intervention in the community. The Welsh Government's Hospital Discharge Guidance sets out advice on hospital discharge standards for health, social care, third and independent sector partners in Wales. The Office for National Statistics found that, in England and Wales, disabled people had higher rates of dying by suicide than non-disabled people. The Welsh Government's All-Age Mental Health and Wellbeing Strategy 2024 to 2034 aims to improve and protect the mental health and well-being of people in Wales. The strategy recognises that disabled people and neurodivergent people are at particular risk of experiencing poor mental health and well-being. The strategy acknowledges the need to recognise the specific rights of individuals so services are available on an equitable basis. The Suicide Prevention and Self-Harm Prevention Strategy also adopts a rights-based approach and references the need to embed children's rights and disabled people's rights into service, design and delivery. Healthcare professionals must recognise and respond to impairments in babies and infants promptly to support their development and well-being. Early intervention ensures that children receive the necessary care and resources to thrive, minimising the impact of any challenges they may face. The Healthy Child Wales programme has been created following an NHS Wales-led review of the way we currently support families with young children in Wales. The Welsh Government is committed to ensuring disabled children and adults have seamless access to healthcare, including mental health services. We are dedicated to promoting accessible and inclusive positive transition arrangements into adult services. Accessibility is not just about compliance, but about creating an inclusive digital environment for all. Artificial intelligence, AI, holds great promise for improving access to healthcare for disabled people, if delivered in a safe, responsible, and ethical way. Considered implementation and continuous evaluation of AI technologies will be needed to ensure disabled people receive equality in healthcare. We have created some high-level principles to help guide the responsible use of AI by the public sector in Wales, so that it is ethical, trustworthy, and aligned with the values and interests of the people of Wales, inclusive, accessible and beneficial for everyone, especially to those who are most disadvantaged, innovative, collaborative and supportive of our research and development ecosystem, and transparent, accountable and subject to the right governance and oversight. The Workforce Partnership Council published their Using Artificial Intelligence at Work guidance, which highlights the ethical considerations of using AI in the workplace. The Centre for Digital Public Services, CDPS, has also published broader, cross-sector guidance on the use of AI technologies. Aligned with this, the Equalities and Human Rights Commission have published guidance on the need to consider the PSED from the very outset of any AI plans. The Artificial Intelligence Commission for Health and Social Care is a senior advisory group of specialists and leaders representing the health, social care and life sciences sectors. The Commission works collaboratively across the sector and with national and international partners to advise and provide direction on the regulation and adoption of safe, responsible and ethical AI for health and social care. An analysis by the Office of National Statistics of coronavirus, COVID-19 related deaths by disability status, England and Wales, 2nd March to the 14th of July 2020, showed that in Wales, disabled people made up almost 7 in 10, 68%, of all deaths involving COVID-19 in this period. The Locked Out report highlighted a number of areas in which disabled people were disproportionately affected through the pandemic, many of which may have contributed to increased health risks such as access to healthcare, housing, income, employment, and social exclusion. The incorporation of ethical considerations into healthcare is vital, particularly when meeting the needs and rights of disabled people. Ensuring that disabled people are involved in the development and implementation of healthcare policies promotes equity and inclusion. Healthcare economic measures have an important role in helping us understand and compare the impact of different health treatments and conditions. However, there are limitations for some tools, such as quality-adjusted life years, which may oversimplify disabled people's life experiences to numbers. Welsh Government is committed to ensuring healthcare is provided equitably to disabled people in Wales through its network to support consistent standards and functioning for clinical ethics advisory groups across NHS Wales. Disabled people have the right to inclusive health and social care services, but these can be challenging to access. Improving the infrastructure and technology of health and social care services, as well as supporting the workforce in understanding the social model of disability, can improve access for disabled people. With the right support, many disabled people can continue to live independently. Disabled people's organisations play a crucial role in this process, providing invaluable support and advocacy. The Social Services and Wellbeing Wales Act 2014 sets out the principles of voice, choice and control for people needing care and support, including disabled people. Recruitment and retention within the social care workforce remains challenging, especially in ensuring that disabled people receive consistent and high-quality support tailored to their needs. This is even more pronounced in rural communities and among Welsh-speaking populations, where access to appropriately trained staff can be limited. Without a robust, well-supported workforce, disabled individuals will face significant barriers to living independently and participating fully in community life. Addressing these workforce gaps is crucial to upholding the rights, dignity and well-being of disabled people throughout Wales. Recruitment and retention within domiciliary services is a significant factor relating to the sufficient availability of domiciliary care. Overall, there has been an improvement in domiciliary care capacity in the last few years, although there remain regional variation, and some parts of Wales, particularly the more rural areas, continue to experience capacity issues that impact on waiting lists for service. The social care workforce is a priority for Welsh Government. We have established the Social Care Fair Work Forum, which brings together trade unions, social care employers and government to work in partnership with the aim to improve pay, terms and conditions for our social care workers. The forum is overseeing a number of work programmes aiming to attract more people into social care. Since 2022, we have been funding the real living wage for our social care workers, and this remains a priority because fair pay is the foundation of a valued workforce. Looking ahead, we want to further improve pay and are working closely with the UK Government to deliver fair pay agreements for social care workers in Wales through the UK Government Employment Rights Bill. We continue to work in social partnership with the establishment of the Social Care Workforce Partnership, who are collectively developing voluntary models of best practice for employers in the independent sector, aiming to bring consistency to terms and conditions across social care. We are also developing a pay and progression framework for social care, which will give our social care workers a clear career path, offering and highlighting the real opportunities to progress in their social care career. We know that there are many unpaid carers supporting the social care sector. A new national strategy for unpaid carers will be published during 2026. The current strategy for unpaid carers has as its priorities identification and valuing unpaid carers, access to information and advice, support for life alongside caring, including access to respite, and supporting unpaid carers in education and employment. These areas continue to be priorities in the new strategy. The Chief Nursing Officer's strategic vision outlines a 5-year path that unites the professions, empowers action, and showcases their transformative impact across the health and care system. Shaped by the voices of nurses, midwives, service users and stakeholders, it defines how the professions will lead, innovate and influence at every level. Driven by 6 transformative themes: workforce empowerment, leadership, excellence, population-focused care, innovation and global partnerships, the vision promotes action, strengthens professional identity, and embeds sustainability in practice. Building on our ambition for a Wales that is equal and fair, where our nursing and midwifery workforce reflects the populations that we serve, and where nurses and midwives shine a light on and address the inequalities that hinder the lives of our diverse communities. We want to make sure that people with learning disabilities who have additional support needs are supported in the community, and where specialist support is required, admission into specialist inpatient services is rare, close to home and discharge plans are in place. We are taking action, improving data collection, and are working with partners to develop appropriate community support services. We will be working to deliver the requirements of the reform of the Mental Health Act, where autism and learning disability will no longer be grounds for detention under Section 3 of the Mental Health Act, unless there is a co-occurring mental health condition. This change aims to prevent inappropriate long-term detention of individuals who do not have a treatable mental illness. In 2022, the Welsh Government established a 3-year Neurodivergence Improvement Programme, NDIP, which ran until March 25, backed with £12 million funding. The programme aimed to improve early access to information, advice and help, regardless of diagnosis, and enhance the provision of post-diagnostic support, taking a whole system approach and tackling waiting times. The NDIP has been extended to March 2027 in response to the growing demand for neurodevelopmental services and to tackle urgent pressures and lengthy waiting times for children's neurodivergence assessments. The key priority is 3-year waits by March 2027. However, the NDIP has 4 other priorities: children's neurodivergence service transformation, adult service transformation, wider system changes from a neurodivergence perspective, and the development of a new neurodivergence code of practice. The Welsh Government is committed to improving outcomes for people living with dementia and their families. We are progressing work on the successor to the Dementia Action Plan, and we are using the published evaluation of the Dementia Action Plan to inform our approach to this work. We are committed to co-production of the new plan and the involvement of partners and people with lived experience throughout. This work is ongoing and has included a number of events and a public questionnaire, which is being used to shape our engagement activities for the successor Dementia Action Plan. The Social Services and Wellbeing Wales Act 2014, Code of Practice Part 2, lays out the need for local authorities to promote well-being and protect individuals. It focuses on preventing the need for care and support through promoting well-being, supporting disabled people and carers. Local authorities provide a variety of preventative services, offer information on community well-being services, and give advice on direct payments and care charges. This helps people plan for their future care needs. Additionally, authorities ensure practitioners and individuals collaborate as equal partners to plan and deliver care and support. Supporting disabled people's voice, choice and control and independence require robust infrastructure in areas such as social care, transportation, employment and direct payments. Direct payments are funds provided by the local authority. They are aimed at people regardless of impairments, but can include disabled children and adults. On the 31st of March 2024, 48,519 adults had a care and support plan, of which 13% had a care and support plan supported using a direct payment. Direct payments are available for social care services and can significantly enhance the independence and therefore quality of life of disabled people and those with long-term care needs by providing greater voice, choice and control. The Health and Social Care Wales Act 2025, which received royal assent on the 24th of March, includes provision for the introduction of direct payments for continuing healthcare (CHC) in Wales. The Welsh Government has published co-produced research exploring the concept of establishing a national centre for independent living led by disabled people in Wales. Findings from this research represent stakeholder perspectives on a range of aspects for a national centre, including the prospective enablers, aims, functions and practical considerations. Launched in autumn 2021, Age-Friendly Wales, Our Strategy for an Ageing Society, sets out the action we will take to prepare for the future. It considers the many things that influence how we age, like health and social care, transport, and even the way we socialise, work and care for others, and sets out our ambitious vision for an age-friendly Wales that supports people of all ages to live and age well. A supporting delivery plan was published in April 2022, which is updated annually. The strategy was co-produced with older people and their representatives. The Ministerial Advisory Forum on Ageing guided the development of the strategy and continues to monitor progress. To support implementation, £1.1 million per annum is allocated to local authorities, £50,000 each, to fund a dedicated age-friendly post. The funding supports local authorities to gain membership of the World Health Organization's network of age-friendly cities and communities. The work is delivered in partnership with the Older People's Commissioner, who is an affiliate member of the WHO network. Age-friendly communities can support all older people to age well and provide environments and communities that support older disabled people to remain independent and engaged. Our vision is for an age-friendly Wales that celebrates age and, in line with the UN Principles for Older People, a nation that upholds the independence, participation, care, self-fulfillment and dignity of older people at all times. Climate change is recognised as a concern in relation to health. A health impact assessment by Public Health Wales highlights that some disabled people are likely to be at greater risk of negative impacts on their physical or mental health as a result of climate change. This may be through disproportionate susceptibility to harm, disproportionate exposure to harm, a reduced adaptive capacity in the event of harm, or a combination of these factors. The Welsh Government's Health Protection Framework describes how the health protection system in Wales will work together for the people of Wales to minimise harm, save lives, and promote well-being. One of its key objectives is that excellent services and functions are delivered safely, equitably, and in a timely and person-centred way that reduces inequalities. The framework emphasises the importance of partnership working and how the entire system should work together across prevention, preparedness, response and recovery in a way which seeks to constantly improve the health equity of the population.